Oh, no. That would be too. I know, I see.
He's getting older already. Without you.
Oh my gosh, it was like
2 more minutes.
Was Ann going to say anything before you start?
I don't know. Is she here?
I haven't seen her.
Yeah, she did. So, we want to remind maybe questions.
I'll check with her. Theoretically, we could feel some issue because. Really?
Okay, great. I'd like to start.
Do you need those websites open?
No, I decided not to.
How about the Word documents?
I've got
Looks
the
like
Word
you've got
down there. Yeah, I've got Word down there. So I think we're okay. So I'll just do, if I need to go, I can just go down to.
Let me minimize that. So that won't
Okay.
cause you a problem. And
I was going to put it on my, I'm going to go ahead and put it on my PowerPoint here, this guy, because this is where I'm going to start.
okay.
Okay, so a couple more minutes here.
Anyway, he had a whole bunch of stuff.
Welcome, everybody. Thanks for being here today. I'm Dr. Ann, and I'm so excited to be announcing our speaker today. But before I do, just a few little housekeeping things I wanted to let you guys know about a few things that we have going on here at the Reardon Clinic. Before I jump into this, though, just out of curiosity, how many people have been out here or never been out here before? New to the Reardon Clinic. Okay, great. So a few hands. Well, welcome. We're so glad you're out here. We've been revitalizing these lectures, and we are just so thrilled to have such a large crowd today. And we just thank you guys for taking time out of your busy schedules to be here and learn about this important topic. So just to let you know, this is being recorded live online. So friends and family who can't make it in person can go back on YouTube and watch this later if they want to. And then also, if there are any of the upcoming lectures that you can't physically be here, or if you have friends and family you want to share it with, this is being streamed live on YouTube and also live on Facebook. So that's kind of a new exciting thing that we're doing. So if at any point you know somebody, please share the information about these lectures, and they can watch it online.
I got to make a setting change, but
okay. And then just to let you know, we have a few upcoming lectures. March 29th, we have our Check Your Health lecture. Check Your Health is an event we have twice a year where all of our lab panels go on sale. So we're having a lecture. If you're interested in Check Your Health, I encourage you to come to that lecture. It's a Wednesday, like I said, March 29th at noon. We also in April, I'll be speaking April 19th, all about sugar. We all love sugar, but we know it's bad for us. So why is sugar bad for us? And is it, really bad for us? So that's what we'll be talking about in April. And then May, Dr. Nia, who is our physician in Kansas City, in our Kansas City office, she'll be talking all about the mysteries of the gallbladder, which if anybody's ever wondered, what does a gallbladder do? Is it really important? Do I need it? She's going to be talking about all the different ways you can naturally support your gallbladder health. And then in June 14th, Dr. Hinshaw will be talking about insomnia and sleep. So those are just a few of the lectures we have coming up. Check your Health Hunter and check your email, because we'll be sending out information as those get a little bit closer. And then a few other things. You all have a survey at the end. If you fill out your survey, we're going to be collecting those and doing a drawing. And we have a gift basket where we'll be giving away some magnesium supplements. We'll also, in that gift basket, will be the ability to get your magnesium blood levels checked. So definitely fill out your survey. And I'm the one that I coordinate all of these lectures, and I'm most interested in knowing what you guys want to hear about. So please write down any topics that you're interested in that you want us to talk about, and we'll try and incorporate those into our fall lecture series. Well, without further ado, I would like to introduce the man who needs no introduction, Dr. Ron Hunninghake. He'll be talking all about magnesium.
Thank you, Ann. I'm just gonna do this. First of all, do you know that Dr. Ann is our daughter, and I'm so proud that that I can work with her. I grew up working with my dad at the gas station, and so there is something special about being with your children and having them live the life that you hope that they would get, and Dr. Ann has really got it. So today I'm here to talk to you about one facet of the amazing story of the Reardon Clinic, because the Reardon Clinic really, it's not about a nutrient, it's about all the nutrients. But in order for our minds to grasp the importance of nutrition, oftentimes it's good to pick out some of the key ones. And so what makes magnesium exciting today is that if it were Dr. Reardon up here speaking, he would probably be saying the most important nutrient is what? Vitamin C. That was his big thing. But as the consensus around magnesium grows in terms of its particular importance, excuse me, let me close this. There's a growing idea that maybe magnesium is the most important nutrient because it is the most far-reaching in terms of how it affects our cellular functioning, our health, our well-being, how it how it ties into so many chronic symptoms and conditions that people are dealing with in our day and age, and how it kind of insidiously shows up as a problem. And I'm going to predict that as we go through the presentation today, you're going to see yourself in the magnesium deficiency issue, maybe in little ways, maybe in bigger ways. Regardless, I'm hoping that it will empower you to start making some changes in the direction of taking better care of yourself. My favorite saying these days is the very best health care is self-care. And as the situations, the polemics of healthcare go on and on and on TV, I think what we can say for sure is that the more you learn about your own health and what you can do to take better care of yourself, the better off you're going to be. Because the best thing about diseases is not to get them, right? And so if you can make choices in favor of staying out of trouble, shall we say, that'll be the best way to go. So anyway, I wanted to start out with Oliver Wendell Holmes's quote that's on our wall. As all of you are aware, we've got quotations all over the place. Dr. Reardon loved to make quotations as a way of inspiring all of us to try a little bit harder, do a little bit better, be our full potential. And this was one of his favorites, and that is, man's mind, once stretched by a new idea, never regains its original dimension. So I'm hoping today we'll see a little bit of that happen as you begin to see how incredibly important magnesium is in terms of maintaining good health. And I put down here on my you've all got the handout here. I'm going to start out with the handout, and then I'll switch to some slides. But I kind of consider this like mini medical school. I mean, every aspect of medicine is touched by magnesium in terms of how it influences our health and our well-being. And so I invite all of you to be what Dr. Reardon envisioned that all of us need to aspire to, and that is co-learners. And the co-learner concept is such a powerful concept because as a physician, it's humbling for me to know that with each new patient that I see, I need to, in a sense, get into their world. I need to understand what's going on in their unique biochemistry. And that's what makes the study of nutrition so different than an academic medical school discussion, because each of us has different genetics. We have different diets. We have different environments, different backgrounds, different stressors, different infections. And all of these things can impact what your body's need is for magnesium. So when someone says, how much magnesium do I need, as if there was some kind of academic answer that gave the story for everyone, it's just not that way. And I think that's probably one of the reasons. There's another big reason, but it's one of the reasons why a lot of times your doctors don't talk to you very much about magnesium, even though I think it's a crucial subject. Part of the reason is that the standard magnesium test, which is a serum level, almost always is normal. And if you, I knew there for a while, and some hospitals still include the serum magnesium level on their chemistry profile, but a lot of them don't. And so one of Dr. Reardon's concerns about modern medicine is that if you don't measure it, you don't see it. You don't see your magnesium level. You can feel your symptoms, and you can go to your doctor with acute symptoms. And the practice of medicine is kind of geared around helping people deal with acute symptoms. And as we'll talk about a little bit more as I get more into this, pharmaceuticals do work acutely, and they can make changes in how you feel rather rapidly, but not necessarily for a good reason. I'm going to show you that pharmaceuticals over the long haul have been shown to deplete, for example, magnesium and other key nutrients, and can lead to a worsening of problems. In the short run, though, a medication can be very helpful to you, but in the long run, you're going to be better off if you're starting to think nutritionally. So this is much like an investment program that it hurts a little bit to take the time, to the expense of getting the supplements, the hassles of taking the supplements, but it's an investment in your long-term health. And if nothing else, as you learn about magnesium today, it's learning about you. It's learning about your chemistry, how every cell in your body requires magnesium. And there are a number of unique ways that magnesium functions that impacts our energy, our brains, our well-being, and also our life and death. Because if you have a really serious magnesium deficiency, it can result in an arrhythmia, and it can kill you. So magnesium is indeed extremely important. So one of the things about magnesium is, what color, does anyone associate a color with magnesium, or what color should we associate with magnesium? White. Well, I'm going to say green, because here's why. Chlorophyll. Chlorophyll is plant blood. The hemoglobin of plants is chlorophyll, and in the middle of that molecule is magnesium. And so magnesium is what gave plants the ability to capture the energy from the sun. And so one of the key words that I want you to go away with today is that magnesium is all about energy. In another lecture that I did about 7 or 8 years ago, I actually had a small ribbon of magnesium, and I had it all set up like a chemistry lab with goggles and everything. I didn't want to go to that today, but I lit it, and it just flared up so bright. Magnesium is a very energetic molecule. And so when we think about oh, by the way, a couple other things is you can get a free magnesium book online. I've got that listed there. And then we have an article on magnesium this month in our Health Hunter. But if you look at the main food sources of magnesium, what you'll see at the very top there is spinach and chard, green things. So if you want to know where to go in your diet, go green. Or any whole food for that matter is going to be pretty much a good source for magnesium. Supplements are kind of interesting. Magnesium, for as important as it is, it's not easily absorbed. It causes a lot of gastrointestinal problems if you get the wrong kind. Unfortunately, a lot of the less expensive magnesium supplements are magnesium oxide. And they work very well as a laxative. Magnesium, if you don't absorb it, it stays in your colon and draws water in. I'm sure you're all aware of milk of magnesia. And so, but we're not really interested, in my mind, we're not really interested in the laxative effect of it. Certainly, we would like for it to do more peristalsis. We want it to help the colon run that wave through it that helps us move the food through the intestinal tract and eliminate it when it's time to eliminate it. But we do not want the disaster pants that can come along with the wrong kind of magnesium. You can use that as a kind of gauge for how you're doing. A lot of people say, well, how much magnesium should I take? The chelated magnesiums are one of your best bets, and you can adjust your dose of chelated magnesium. A lot of people take it in the morning to kind of get the day going in terms of energy, but one of the other really good times to take magnesium is at bedtime when you're trying to get to sleep, because magnesium is a wonderful muscle relaxer. It also calms the brain. It helps you detoxify excessive adrenaline. If you're geared up about something, magnesium will kind of help calm things down. And it's better absorbed during the night, because absorption is the big problem with magnesium, trying to get enough of it in. There's a lot of different chelated forms of magnesium. I'm not going to go through all of them. Most of them are okay. There's some people that have, and this is probably more in detail in that book that was written by Dr. Carolyn Dean. Dr. Carolyn Dean was one of our speakers at last October's symposium that we had downtown, and she's considered perhaps the foremost authority on magnesium in the world today. She's coming out with the 3rd edition of her book, The Magnesium Miracle, and it's well worth getting. But if you want a nice summary of that book, then go online and you can download this PDF and pick up a lot of information about magnesium. She has developed a really powerful new way of taking magnesium that's where she I remember Dr. Reardon telling me that we doctors need to talk more to the veterinarians, that veterinarians know a lot more than they're given credit for. And one of her consultants was a veterinarian that developed a form of magnesium chloride, which is normally only about 40% absorbed. She developed with him a picoionic magnesium that's called Remag that's 100% absorbed. It's almost like getting an IV of magnesium. Another little by the way, I'm going to have all these by the ways because they just keep coming to me as I talk about this. We give a lot of intravenous vitamin C here at the Reardon Clinic, and so this is probably how most people around the world know about us. Every one of those IVCs contain magnesium, and as time has gone on, our dose of magnesium with the IV vitamin C has gotten higher because we see better and better results. Chelation, which is another really powerful intravenous therapy for detoxification, always includes magnesium. So is it the EDTA chelating, or is it the magnesium or the vitamin C that's helping people? I don't know. Very often these nutrients work in combination, but keep in mind that magnesium is an integral part of a really good healing program. If you can't tolerate, and there are people that can't tolerate magnesium supplements very well, keep in mind that it is absorbed fairly well topically. And I put these here just as a reminder to myself. I want to talk a little bit about magnesium oil. Magnesium oil is really not an oil. It's magnesium chloride that's been concentrated, and you can rub it on your skin, and it really will absorb into the area. There's one upstairs called Ancient Minerals that's got MSM in it, so if you have leg cramps at night, I know my wife will jump out of bed and rub magnesium on her legs and able to go right back to sleep. Or if you've got back pain or muscle pain anywhere and you can't tolerate a lot of oral magnesium, topical magnesium works quite well. If you're stressed at the end of the day, take some Epsom salts, which is magnesium sulfate, and put a couple cups of that in your warm bath with a little bit of lavender essential oil, light a candle, put on some nice music, and you can get very, very relaxed. And matter of fact, one of our consultants says that's how he diagnoses magnesium deficiency. If you can do an Epsom salts bath and your blood pressure goes down and you feel really good, you probably need that extra magnesium. So magnesium detoxification is a really good thing to do. If you have trouble, I'm going to still talk about this. If you have trouble that way, or if you really need a lot of magnesium, we give magnesium intravenously. We can also give it as injections. We have a special this month here at the Reardon Clinic for those people who feel like they need a higher amount of magnesium. We have injections available for our patients at a discount. We have a Check Your Health event coming up next month where we are going to allow for people to come in and check their magnesium levels. Now, the serum magnesium, like I said, won't help you that much unless you are really deficient. I mean, if you're really deficient, like my dad was. I remember as a young physician, my dad had to go to Topeka because he was having irregular heartbeat and chest pain. And the doctor in our hometown was very concerned that he might be having angina, chest pain, heart attack pain. And so he sent him to Topeka. And fortunately, the cardiologist there did do an RBC magnesium, and it was low. He also found out that the heart cath came back normal, so there was no blockage in his arteries. But because of that, two things happened. He convinced my dad to stop smoking, yay. And he also got my dad to take Slow-Mag, which is a commercial form of magnesium that he took for the rest of his life. And the PVCs that he always had skipped heartbeats, those went away once he started taking magnesium on a regular basis. So there is some value for doing a serum magnesium level. If it's low, then you really need it. But the RBC magnesium level, which we offer here, is a little bit better because it's an intracellular measurement of magnesium. And as I'm going to show you in just a few minutes, almost all, like 99% of the magnesium in your body is intracellular. There is some in the serum, and that serum level is very tightly regulated by the body, and that's why you won't see a serum level being low. But the RBC magnesium, if it's in the low end of normal, you can pretty much bet that you're not getting enough. There are some new magnesium tests that are coming out, ionized magnesium, which we're hoping to do here in the future, and the magnesium loading test, which is a test from the past, which is currently not available, but which may be another way of assessing your magnesium status. But I did list there symptom assessment. You know, you probably, who lives with your body all day long? Besides your spouse or someone. You. And so you're the best judge of what your magnesium level is. Now, your mind has to know how to interpret your symptoms, because in conventional medicine, the training is that if you have a stomach ache or irritable bowel, there's a medication for that. So what I'm wanting to offer you today is that take the long view of your symptoms. What else could these symptoms be indicating, and what else could I do that would be safe and effective in my own right? And so trying to work with your diet, increasing the number of greens, or there's a number of green powders that you can use, or trying magnesium supplementation could be a very effective way for you to deal with a nagging symptom that for some reason no one else has been able to help. Or if you are on a number of medications for various symptoms, it could be that some of the medicines are actually interfering with your absorption of magnesium, such as the acid blockers. We now have a population of people in the United States who are addicted, not in the same way you're addicted to like heroin or something, but who cannot stop their acid blocker without having GERD or reflux esophagitis occur very quickly, especially if they eat sugary foods. Sugary foods and certain other things like coffee can trigger reflux. And what happens is that you knock out the acid, and every time you try to eat something and you're not taking the acid blocker, you reflux again. And it turns out that magnesium could help you. You could have a magnesium deficiency, especially if you've been on it for a long time, because your food that contains magnesium has to be digested and broken down by acid before your body can get to the magnesium. So if you've been on an acid blocker, you've been triggering a low-grade magnesium deficiency for forever, how many months you've been on it. So when you want to get off of it, you need to start adding some magnesium back and then do a kind of a tapering program in order to be effective. The magnesium will prevent there's one thing that a lot of doctors don't know is that there's a valve at the bottom of your stomach called the pyloric valve, and if it's in spasm, you can't empty your stomach very well. And every time you try to eat something, it'll reflux back up. So magnesium will open that valve. It'll promote better peristalsis of your stomach, and it can help the esophagus keep moving the food down rather than allowing it to go back up. So that's one of the more common manifestations of magnesium deficiency. Why do so many people have trouble with magnesium, and why is this seems to be such an epidemic in terms of our culture? Part of it is that the way that we're fertilizing the soils these days is such that we're putting the nitrogen and the phosphates in, but we're not putting the minerals back. We're not rotating crops in the same way that we used to, and so a lot of the trace minerals are being lost. The standard American diet, SAD, standard American diet, is sad because very often it's loaded with sugar, and what we're going to find out is that sugar, stress, various non-whole foods, they tend to cause the dumping of excess magnesium. Dr. Julian Whitaker is well known around the country, and I heard him give a talk one time about diabetes being a nutrient wasting disease. If you have high blood sugar and your kidneys are constantly eliminating excess sugar, you're losing a lot of magnesium as well as other trace minerals. Stress itself can cause you to deplete magnesium because when you're under stress, your body's putting out more cortisol, more steroid. It's putting out more adrenaline, more catecholamines. And all of these things are using up your magnesium reserves fairly quickly. Medications, as we talked about earlier, can be a major source of problems. I'll come back to that later on in the lecture. And then just not knowing that magnesium is as important as it is, or that it's lacking in the modern diet. I'm going to show you some evidence for that. But not knowing is not being able to make a choice in favor of taking better care of yourself. And so this is why the co-learner concept is so important, and knowledge is power. And in the field of nutrition, you have to, in many ways, be somewhat your own doctor, your own caregiver. You have to read up and be willing to try things on a safe basis. But more often than not, if you don't change what you're doing, what's the definition of insanity? Doing things the way you've always done them and expecting a difference. So I'd like to challenge all of you to, after today, try some different things. Look into some magnesium ways that you can maybe improve it either in your diet or with some supplementation. I wanted to just briefly go over the magnesium functions, just so that you know how important it is at the cellular level, and then we'll come back to the last page or so here. Just one thing I just wanted to show you on the very back. We'll come to all the conditions, but on the very back, there's a very complicated chart that Dr. Ann and I have gotten very much involved in, and that is methylation. And methylation is probably one of the most important functions within the body because there are over 400 molecules that your body makes in order to be healthy. And what it is, it's a carbon transfer mechanism that every cell in your body utilizes. If you noticed up here to the very top left-hand corner, we've got a little red circle that we've put where we've circled Mg, which is magnesium. And that's the conversion step between methionine and SAM, S-A-M. And SAM is what we call the second most important molecule in the body because it's what actually gives the methyl group to all these 400 and some molecules that you need in order to be healthy. If your magnesium is low, that conversion from methionine to SAM doesn't work very well, and very likely you're going to be undermethylated, and you're going to have trouble with homocysteine and all the problems associated with methylation. So that's just an example of how just one enzyme, if it doesn't have adequate amounts of magnesium as a cofactor, there's a downstream effect that's very pervasive in terms of the body. The other factor that I want to mention, if you look at that magnesium, it interacts with ATP. Now, ATP is a very interesting kind of enzyme in the body. It's your energy currency. It's what your cells make in order to give us energy. And part of this comes from photosynthesis, storing the sunlight energy into glucose, and then our cells break down glucose as part of a cycle called the Krebs cycle. And from each molecule of glucose, we can get over 38 molecules of ATP. Every cell is doing this all day long, and it is estimated that we make our weight twice every day in ATP. That's how important the ATP molecule is for our energy. ATP doesn't work without magnesium. Magnesium attaches to ATP, and that's what gives it its activity. So just right there, you should see that if you're tired, if your brain is foggy, if you've got muscle aches or muscle fatigue, if you're depressed, if you're not sleeping very well, right there you should see how magnesium could be a very important catalyst in helping you to gear up and feel better and have more energy. I think fibromyalgia patients who have chronic fatigue, very often I find them to be, for example, very low in magnesium. So back to where we were, the general magnesium functions. So it catalyzes most chemical reactions in the body. I just showed you one, but they are now saying that there are Dr. Dean used to say back in 1968 when she first started lecturing that there were about 325 enzyme systems that require magnesium. Now she's saying 700 to 800. And she's not just saying that. This is all in the literature, the medical literature. I just mentioned about how it produces and transports energy. It's very important in the Krebs cycle. Protein synthesis. 3,751 magnesium receptor sites have been found on human proteins. Nerve transmission. All of your body functions on the. We are electrical beings. The fact that we can pull out our cell phone and use our finger and do things on that flat screen is because there's an electrical charge around us, and that's based upon the fact that magnesium maintains an electrical gradient across the cell membrane of every cell in the body. That's what makes us. That's why we're alive, is because of magnesium maintaining that electrical gradient. Your nerve cells transmit that electrical gradient, and without magnesium, that signal is very weak, and that's part of the reason why having a good magnesium level is very important in terms of your brain functioning. It also is crucial in terms of muscle functioning, and if you learn nothing else in this lecture, you have to know that when you are not having enough magnesium, you're going to have trouble with spasticity, muscle tics, back spasms, irritable bowel spasms, headaches, muscle spasms in your brain and in your muscles around the head. And why is that? Because when you don't have enough magnesium, one of the things that magnesium does is it keeps excessive calcium out of your cells, and then when your cells do depolarize, like when your heart beats and calcium comes into the cells, the heart contracts. But it's the magnesium's job to push that calcium back out again. And if you don't have enough magnesium, calcium will build up in your cells, and you'll be in a more or less constant state of spasticity. And I've had so many patients who they have leg cramps, or they have headaches, migraine headaches, or angina is a type of smooth muscle spasm. Irritable bowel is spasming of the colon or the small intestine or the stomach. So anytime you've got spasticity, you should be thinking magnesium is possibly an issue for you. And you can either go get it checked, get your levels checked, or you can start using gradually increasing amounts of magnesium. Don't run out and take a whole bucket full of magnesium. Disaster pants if you do that. Because that's where the magnesium, it doesn't absorb very fast, and so it'll just pull water in, and you'll get diarrhea. But if you slowly increase your dose, and if you spread it out over the course of a day, you can very often see dramatic results. Dr. Dean is a big advocate of using her liquid magnesium in a quart of water. Start out with a half a teaspoon, and drink that quart slowly throughout the day. Put a little sea salt in it because you need the other trace minerals. And then you can gradually titrate or adjust your dose of magnesium up until you start to get symptom relief. That's the low-tech way of helping your body recover from a magnesium deficiency. And it will relax your muscles, and you will feel energized. This is not like where you feel dulled magnesium can actually improve your brain functioning, energize you, as well as relax you at the same time, that's the goal. It's very important in terms of blood sugar regulation, and we have a rapidly rising number of people in the United States, children included, who have type 2 diabetes or worse. Type 3 diabetes is actually one of the fastest growing areas. I don't know how many of you have heard of type 3 diabetes, but that's where the insulin receptors in your brain doesn't work properly, so you can't get glucose into your brain, and this is where the ketosis diet is coming into play, and using coconut oil and different things as an alternative pathway. But if you can improve your magnesium, that's really important, because the brain cells, the average cell in the body contains about 500 to 1,000 mitochondria. These are the little organelles in your cells that generate ATP. The brain has 10,000 mitochondria per brain cell. So you really need a lot of magnesium to biologically activate the ATP in your brain. And so, plus it will also help reduce insulin resistance. Magnesium is very important in terms of detoxification as well, and we'll talk a little bit more about that. So at this point, I'm going to go ahead and switch to my slides here. I'm going to try to go through these slides in about 10 to 15 minutes so that I can open this up for questions, because I'll tell you, there's too much stuff here to really try to cover everything, but I'm kind of giving you a view of some of the highlights of magnesium. So some of this is going to be a little bit repetitious, but I think it'll be good. Repetition is the mother of learning. So we've already talked a little bit about this. Here's minerals, and I think minerals don't get enough credit. We talk about vitamins, and then we say vitamins and minerals. It should be minerals and vitamins and amino acids and fatty acids. But minerals are kind of a foundational thing that really we have to work at getting these days, because of what's happening in the soil and the way farming is done. A lot of the herbicides and pesticides act as chelators, and they lock the minerals into the soil. So there's very clear evidence that our foods are gradually losing their mineral content. And so sea salt and various other mineral supplements can be one of the best ways to improve your health. And you can see that all these minerals work together, but magnesium is one of the kingpins. Now, this is probably the biggest story that many of you probably haven't heard, but calcium has been oversold to us. Of course we need calcium. We need calcium for our bones, and we need it for proper muscle tone. But what's happened is we've gone overboard with calcium, and we're not getting enough magnesium. And it turns out that when calcium builds up inside of the cells, and that happens when you don't have enough magnesium, and that's probably the main reason why people are developing excessive calcium, that will cause the cells to contract, and they won't necessarily function in the way that they were designed to do. Magnesium, it turns out, is nature's calcium channel blocker. You know, there's a lot of medicines that mimic nutrients, and so that you can use calcium channel blockers, but keep in mind that magnesium is a natural calcium channel blocker. The intracellular concentration of magnesium is 10,000 times the external cellular level. And so that's why if you start to lose that intracellular abundance of magnesium, then calcium and sodium will start leaking into your cells. You'll start being more puffy. You'll start being more tired, more spasticity, more fatigue, less electrical fluency in your body. And that's partly because we've got to maintain these ATP pumps. These pumps are what pump the calcium out and the sodium out. And so these pumps are fueled by magnesium and potassium. Interestingly enough, I did learn about magnesium when I was a medical student. And the way it was taught to me back then is if you have a low potassium, I don't know how many of you have had your chemistry done, and the doctor said, oh, your potassium is low, you better eat some bananas to get more potassium. And that's fine. The problem is if you're really low on magnesium, you can't get your potassium up. And so the trick question in medical school was, if your potassium level won't come up, even with IV potassium, what are you missing? Magnesium. So I did hear about magnesium in medical school. It's just that it's not commonly thought about. So here's what I want you to visualize. What are the problems of aging? When you think of grandma and grandpa in the nursing home, or someone you know, maybe someone you know really well like yourself, that's getting older, and you've got problems with calcification, you've got bone spurs, or the doctor says you've got calcium in your arteries, or maybe you've got a valve in your heart that's now calcified, or maybe you've had a mammogram and there's calcium deposits in the breast tissue, or calcium can build up in the prostate in a similar way. And these are all not good signs. These are signs of inflammation. And just taking more calcium is not the answer. Calcium can result in kidney stones, those kinds of things. What it turns out, and this is why I brought these bottles with me, turns out that magnesium will improve the solubility of calcium. So in her book, Dr. Dean says you can actually do this experiment. You can take one of your calcium capsules, empty it into a bowl of water, stir it, and you'll get this milky solution of calcium water. But it won't dissolve. But if you then open a magnesium capsule into it and start stirring it, suddenly the water will become crystal clear, because the magnesium increases the solubility constant of calcium. Now that's very important, because if you are prone to kidney stones, or you've got plaque in your arteries, or you've got excess calcifications elsewhere, you should be thinking about magnesium. Now, one of the places, I'm going to give you a little take, this may be the only thing you remember from the lecture, but magnesium oil. One of my patients has Tourette's. So with Tourette's, he's got lots of jerks, and he was having lots of esophageal problems and lots of problems relating to magnesium deficiency, and we're working on it. He's better. But he actually, I said, you need to read Dr. Dean's book. And you know what? He did. And so when I saw him the next time, he said, you know what, doctor? You told me to take extra vitamin D. How many of you are taking extra vitamin D these days? Did you know that vitamin D will lower your magnesium levels? Yeah, so extra vitamin D means that you need more magnesium level. And he said, you didn't. I said, oh, I didn't know that. And he says, you didn't read the book? I said, well, not yet. I've started it. So anyway, as another thing that he discovered, and I don't know, I have not read this in Dr. Dean's book, but when you go to the dental hygienist and they start getting their little instrument out and chipping away that tartar, that calculus on your teeth, guess what? If you spray some magnesium oil on your toothbrush when you're brushing your teeth, that'll all come off, because magnesium will solubilize the excess calcium in the tartar around your teeth. And that will result in less inflammation in your gums. And that will improve your dental health. So here's just a simple little thing you can do right away. Buy some magnesium oil and start spraying it on your toothbrush and brushing with your teeth. It's a type of simplified oil pulling. Some of the other people here know about oil pulling, but this is a simple thing that you can do to improve your dental health. So magnesium helps to get the excess calcium out of your cells by enhancing the ATP pumps, and by also solubilizing calcium so it doesn't get stuck in your tissues, because a lot of what we call aging is the buildup of excess calcification. So we don't want that. Now, we do want strong bones, and a lot of people don't realize that calcium is only part of the equation, and most of the calcium you need you can get from your diet. But with magnesium, because it's not absorbed very well, you need to be thinking about either adding additional greens or getting a magnesium supplement in order to get your calcium level up. The result of that will be is if you do get calcium out of your cells, you'll have less inflammation, because calcium in excess triggers inflammation. And so this is why Dr. Tom Levy, who's a good friend of mine, has written a book. It's pretty shocking when people see about death by calcium. Is it that bad? It's only bad if you're overdoing calcium. You really do need calcium, but you need the balance between calcium and magnesium. And magnesium is probably your best calcium regulator. So we've talked about hypomagnesemia. That only happens when you're really, really low. So hopefully you won't be told by your doctor that you have a low magnesium. So try to avoid that. Here's what's happened over the last, looks like the last 100 years, 110, 20 years, is that we have progressively decreasing amounts of magnesium. Used to be that if you, how many of you have had well water and drank well water? You know how it has that real hard taste? That's magnesium and calcium. And of course, in the city, we use the water softeners to get all that out and substitute the sodium for it. So we're getting too much sodium and not enough magnesium or calcium. And so that's part of the reason why magnesium has gone down. The other part is the soil. The other part is the food. Our food, we're having more, especially in your packaged food, there are more and more non-foods like sugar, trans fats, various things that are being added to food, flavor enhancers that are depleting the magnesium value of the food that you eat. So part of what Dr. Ann and a number of people here talk about is trying to buy real food, try to get the locally grown food if you can. Organic is great. You're less likely to have toxicants in the food. But this graph shows why there are so many people that have fatigue, diabetes, depression, heart disease, cancer. So many of the chronic illnesses are related, not completely to magnesium. And that's one of the things I hope you go away with, is that magnesium is not the cause of all these chronic illnesses, but in conjunction with other deficiencies, it's a catalyst. If you're deficient in it, you're going to have a higher risk of some of these other problems showing up. Here's an example of governmental doublespeak. There's quite a bit of that these days. But even though dietary surveys suggest that many Americans do not consume magnesium in the recommended amounts, magnesium deficiency is rarely seen in the United States in adults. And so I think what they're really saying is your blood level of magnesium may not be so low that you're diagnosed as magnesium deficiency, but you could have a suboptimal level of magnesium for your body. Your body may need more than what it takes just to maintain a normal blood level. So that's why just looking at levels alone is oftentimes not enough. You have to do that kind of personal research, trying magnesium in slightly higher amounts, letting your bowels tell you how well you're doing. Dr. Reardon used to always have people increase their vitamin C gradually over the course of several weeks or months until their bowels started to get a little bit loose. You can use the same technique with magnesium. And Dr. Dean says that's the safety factor of magnesium. If you try to take too much, your bowels will tell you, hey, cut back. You're getting a little bit too close to the disaster pants category. Diarrhea also is a cause of magnesium. If you're someone that has irritable bowel and frequent bowel movements, especially watery bowel movements, you may be becoming magnesium deficient. Your diet, of course, we've talked about that. Diuretics, that's a major cause of magnesium and potassium and other mineral deficiencies. If you are diabetic, you need to be thinking about making sure you have adequate amounts of magnesium, because the sugar that's going out in your urine is pulling magnesium with it. There are a number of drugs that interfere with magnesium, either absorption or utilization. If you're a heavy drinker, and in her notes, Dr. Dean says 7 drinks a week. And I thought, oh gosh, I'm a heavy drinker. Just a drink like that a day can deplete your magnesium levels. Magnesium, one of the other places I learned about magnesium was in obstetrics, because if you're pregnant and you start spilling a lot of protein in your urine, or your blood pressure goes up, we now know that that's preeclampsia and eclampsia. That's a sign of magnesium deficiency. And what the OBGYNs will use is IV magnesium in large amounts. Don't wait until it's time to deliver the baby. Be sure you're getting enough magnesium throughout the pregnancy. Decompensation, if your heart doesn't get enough magnesium, you'll start to get into congestive heart failure. Denuded skin, people who have had bad burns, they're going to lose a lot of magnesium. All kinds of endocrine problems are related to magnesium deficiency. Another cause for magnesium deficiency I put down here, I added this one, was dogmatic. If you say, I'm only going to take magnesium if my blood test shows I'm deficient in it, well, you're waiting too long. Think in terms of what you can do to be preventive, proactive in your use of magnesium. So all of these symptoms, these are very common symptoms that we see in our patient care here at the Reardon Clinic. And oftentimes they've been there for many years, sometimes decades, and no one has checked their magnesium level. No one has suggested that maybe they have a magnesium deficiency. It seems like the sicker you are, the less likely you are to eat well, and it may be tied into aging, it may be tied into excessive calcium accumulation, any number of things. Drugs, if you're on, part of the reason I work here at the Reardon Clinic is I was the medical director of a nursing home. And what I noticed is that as people got older and got put into a nursing home facility, very often they were on 5, 10, 12, 15 or more drugs. And it seems like the more they were on, the worse their symptoms got. Because very often doctors prescribe drugs to treat a specific symptom. They're not looking necessarily at the big picture. So look at the big picture in your life and see if there are patterns that suggest to you that maybe magnesium is something that would be helpful to you. So these nutrient deficiencies do masquerade as chronic symptoms and chronic conditions. They come on gradually. When you go in and talk to the doctor, most doctors only have about 5 to 10 minutes with you, and they're going to diagnose your symptoms as a disease. And for every disease, their training is, here's your medicine. So you have to think a little bit differently than what conventional we're not against the acute use of medications. They can be very, very, very helpful. If you're in congestive heart failure and you go to the emergency room, a diuretic can save your life, even though the long-term use of that diuretic make your magnesium deficiency worse. You have to think in terms of acute care and then the chronic care that's needed in terms of better nutrition. And just keep in mind that your doctors are not thinking deficiency. They're just not going to, I mean, maybe there are a few, but generally speaking, they're too busy. And deficiency is one of those things that you almost have to kind of see the whole pattern, because we'll spend 90 minutes with a new patient. And what I'm looking for are the big patterns that suggest that there might be nutrient problems or hormonal problems or things that we can address without necessarily adding more meds. So your daily magnesium gap, it only takes a small gap over a long period of time for you to develop a deficiency. If you're using a little bit more sugar than you should, or if your stress level is high, or you don't sleep very well, or you're on a medication that's blocking your absorption of magnesium, all of those things over time can lead to a deficiency state. So you can now at this point, and I'm gonna finish up here in about 2 minutes, but what I want to do is answer any questions you have. There's 100 magnesium deficiency conditions that are listed in your handout. There are actually 68, but there are a number of subcategories, and when you add them all up, it's 100. And if there are any questions that you have regarding these specific areas, I'll go through a few right now. People who are on hormone replacement therapy or birth control pills, estrogen can shift magnesium out of your blood into the tissues. That can be helpful in general, but you're going to lose the blood level of magnesium. When you lose magnesium in your blood, it makes it more coagulable, and this is one of the theories as to why estrogen is thought to be a pro-clotting supplement. So you have to be careful about that. So if you drink a lot of distilled water, that could be a problem. Bottled water, reverse osmosis water, all these take magnesium out of the water. Water softeners. If you drink a lot of sugary fruit, vegetables, and things, that increases your excretion of magnesium in the urine. This is a little line showing that when you have high insulin levels, if you have insulin resistance, it's going to cause increased kidney loss of magnesium. That's going to gradually lower your intracellular magnesium, which allows the calcium to leak in, which causes inflammation, which makes your insulin resistance even worse. Your cell membrane doesn't work, your ATP pumps don't work as well. You start to have higher insulin levels. Insulin is a fat storage hormone that causes obesity. You will retain sodium, you get high blood pressure, and your lipids will go up. So these are all domino effects that relate to magnesium, at least as part of the equation. Soda pop is rich in phosphoric acid, which can be a problem, and it's low in magnesium. Refined flour has half the magnesium as whole grains. Diuretics we've talked about. If you have high cholesterol, that can be a sign that you have a magnesium deficiency. It turns out that magnesium activates the ATP that regulates the HMG-CoA enzyme that is normally blocked by a statin. But if you take enough magnesium, you can slow down that enzyme, and so you won't make as much cholesterol. So if you're worried about your cholesterol being high, that could be a sign that you are not getting enough magnesium. We've already talked about stress and catecholamines. This is the recommended daily allowance, which is for most people, if you've got any of these factors going on, you may even need more than, this is for people who are, quote, normal. How many normal people do we really have in the world? These are reference ranges, but we're all unique, biochemically unique. And so a lot of times the drugs that people take are really just they're used to treat the symptoms of magnesium deficiency. Antiarrhythmic agents, calcium channel blockers, beta blockers. You know, magnesium is an excellent beta blocker. Beta is a type of medicine that blocks the effect of adrenaline on your blood vessels and in your brain. Hypercoagulability. So a lot of your diabetes medicines can make magnesium worse. Antibiotics are fluoridated. A lot of your antibiotics are fluoridated, and fluoride binds up magnesium. That's why fluoride in the water is not a good thing either. And there was just a study that came out now that mice that were given fluoride actually increased their risk of calcification of their renal arteries, and they were able to show that. So I think at this point I could go on and on here. You can see the cardiovascular. These are the things that can happen to your heart and to your cardiovascular system if you're low. So these are some pretty serious things. Of course, digestive problems are common. Kidney stones, spastic bladder, irritable bladder, that's all can be related to low magnesium. There's a number of gynecologic conditions like severe menstrual cramps, PMS syndrome. That's related to low magnesium. We talked about metabolic disorders, musculoskeletal problems, spasms, muscle tension, and neurologic problems. Magnesium has been very effective for seizures. The brain becomes hyperactive if it lacks adequate magnesium. So magnesium tends to calm the brain down. So it's very helpful for migraines for people who are using it. Now, here's one last little tidbit of information. Dr. Dean suggested this. If you've got tinnitus, this won't work for everyone, but a lot of people who have tinnitus have calcifications built up in their cochlea, in the hearing apparatus, or the semicircular canals. If you put a few drops of her Remag solution into your ear, you can start to pull out some of the excess calcification. So many of the so-called mental illnesses are related to magnesium deficiency: anxiety and depression, irritability, panic attacks. So at this point, I think what I'm going to do is stop, and Dr. Ann will be available with her, do you have that, Ann, the microphone? Yeah, just raise your hand and I'd be happy to take some questions.
Real fast, before we start questions, if you guys have filled out a survey, Connie's going to come around and collect those so that you can do the drawing right after questions. So.
Yes, two questions. One is there a side effect of too much intake of magnesium?
Yeah, I didn't get to that in my slide. That was going to be my next slide. If you have renal failure,
If you're on dialysis, you have to be very careful about magnesium. If your kidneys are good, though, there really is almost no side effects other than diarrhea. So if you get too much, you'll start to have loose bowels. Some people who have conduction defects of their heart, if you've got a pacemaker, you might want to check with your doctor before you start taking too much magnesium.
The other is, you mentioned sea salt more than one time. Are you referring to what they call sea salt or just any salt that is on the market?
No, the best sea salts are the colorful ones. And the reason they're colorful is they've got like 70 plus trace minerals in it. So by using sea salt, you're going to get more of these trace minerals that you're not getting in the food these days. So it's really a better way to use salt. And it seems to be, now if you've got congestive heart failure or other conditions, you have to be careful with that. But generally speaking, most people can tolerate sea salts quite well.
I saw where you said about the carbonated water.
Yes.
What about Perrier? Because it's supposedly a natural.
I think it's okay. Yeah.
How would the magnesium, would it have any effect on the disease of dystonia?
Yeah, I mean, dystonia is basically a spasticity of the vocal cords, one way of looking at it. It might be a factor. Now, I always tell people that's one of the things that I would check, would be to check the magnesium level and possibly do a therapeutic trial of magnesium. But there could be other neurological components to it. But it certainly would be something worth looking into, because that's a muscle problem, a muscle spasm problem. Okay. Go around. Actually, if all I've done today has got you thinking about magnesium and wanting to read a little bit more about it, then I feel like I'm successful, because the topic is very, very broad. Yes?
Would you like to talk a little bit more about this ionic magnesium, this 100%?
Yeah, the normal magnesium chloride, the size of those ions are about, they're about 3,000 parts per million. The picoionic remag is 60,000 parts per million. So it's much more dense and concentrated, and Dr. Dean feels that it's better absorbed. Now, I've used it with patients quite a bit now, and if you overdo too much, two things can happen. You can go through a detoxification and not feel very good, because magnesium will help with detoxification, or it can give you loose stools. Not in the same way that a poorly absorbed magnesium does, that it pulls water in, but the remag enhances peristalsis. So for people that have chronic constipation or irritable bowel, it can be very effective. But I recommend that you use it the way that she recommends, which is to put it in a quart of water and sip on it through the day. And that way you're not going to get too much at any one time.
How do you make this picoionic?
I don't make, it's a product. Yeah, so we have it upstairs.
Can you cook it out of food, such as if I steam the spinach? Is it
Well, okay, you can't deteriorate it like you can vitamin C or some of these, but if you cook your food a lot, I suppose some of it might leak down into the water that you throw away. So I would say steam your food, and you're more likely to retain it better.
We have a little neighbor, 5-year-old neighbor, that he's allergic to a lot of things, and he has some type of eczema. It's so bad that it's bleeding. He's always itchy. Would that be a sign of?
It could be. It's not a typical sign of magnesium deficiency. What I oftentimes see is that these nutrient cofactors will interact. If you're deficient in 2 or 3 different things, it can show up as problems. More often than not, I find that's related to essential fatty acids and digestive problems. Yep.
What would be the ratio of magnesium to calcium that you would recommend?
Well, I'm going, a lot of people we've been so inundated with the importance of calcium that a lot of people, the old supplements, I think where it was a 2-to-1 ratio. The current thinking is if you eat a healthy whole foods diet, you don't need any calcium supplements. It's in your food, and you're probably safer that way. For some people, though, that's a little bit too big of a jump, and so for them I'll say do a 2-to-1 ratio. If you feel like you want to take some calcium supplementation, you're not ready to give it up yet, then make sure you're getting twice as much magnesium as you are calcium.
Okay, thank you. And one more to piggyback on the salt question. So Himalayan pink salt would be considered.
Yeah, any colorful salt, Celtic, Himalayan, real salt. What's the one from Hawaii? Red. Yeah, there's a number. Thank you. There's a number of whole foods. These salts are mined from areas of the country that one time were underwater, and so the salt from that ocean was deposited underground. So they mine it, but it has all the minerals of seawater, and so there's a lot of really good trace minerals in sea salt. That's people who've had a burn. If you're in a burn unit, you're going to be losing a lot of minerals and nutrients through the burnt skin. And so burn patients have to be watched very carefully for magnesium levels. They're ones that need to have the serum magnesium level done to make sure they don't get deficient. Iodine is not in large amounts. There's a very, very small amount of iodine in the sea salts, ironically. But you do need iodine. The iodine that's in regular table salt, unfortunately, is not a very good absorption form. And plus, every 40 days, half of the iodine in table salt will evaporate or sublimate away. So a lot of people think they're getting iodine from salt, but not very much. So I usually do recommend an iodine supplement for people, especially if they have thyroid problems or glandular type problems. Sure. Yeah, I'll find out. Just come up afterwards, and we'll probably make it available on our website so you can download it. Yeah, right up here, Ann.
I probably really don't need this microphone, but you have down here dark chocolate, 1 square. Can you define what the issue? Typically an ounce, but what constitutes dark chocolate?
Well, yeah.
With that.
My daughter said, "Yeah, that's 1 square." You know, like chocolate. It turns out is a very it's a healthy food. It's very rich in magnesium. The problem comes in if you get the really high sugar content, you're going to lose the benefit of the magnesium that you're going to get and some of the other antioxidants. So really, I think you have to use your own discretion, but a certain amount of dark chocolate every day is a good thing.
Well, I was looking at like children, if they're hyperactive, they might eat a little.
Hey, that's a good idea. Yeah. But be careful. Make sure you get the low sugar dark chocolate.
Perrier water, you have to be careful. When you look at the actual analysis of the water, because it's naturally carbonated, but that doesn't mean it's magnesium.
No, that doesn't mean there's any extra magnesium in it. Most of your mineral waters don't have enough to really satisfy the type of need that we have in this country because of the low dietary intake and the number of factors that are depleting magnesium. You almost need some kind of a magnesium supplement. One more. It does, for the simple fact that if you are under-energized, if you do not make ATP in your mitochondria very well, then your cells will start to shift into what's called glycolysis, which is a very inefficient way of utilizing glucose. And you only get a couple ATPs per molecule of glucose. And then the byproduct of that is lactic acid. This is why people in advanced cancer become cachexic. Their bodies are shifting into this glycolysis. They're forming a lot of lactic acid. and they get tired and they don't oxygenate their tissues very well, and a lot of negative things start to happen. So yes, I think it does. It probably for just the average person walking around, it's not a big deal, but it is something to be thinking about, yes. Well, everyone, thank you so much for your attention. I'm sorry to give you so much information so fast, but I really wanted you to see that this is a very important topic, and hopefully it will be of use to you in your future health. Thank you.
Just a few quick announcements. Today, for anybody who attended the lecture, all the supplements are 20% off. So just let them know if there's anything you need to get. Today would be a great day to get it. Just let them know you're at the lecture. And then also, if anybody wants their magnesium level checked, you can check your red blood cell magnesium level today. It's on sale for $40. So just ask one of the staff out in the waiting area where that's happening, but you can get those levels checked today. Or you could also sign up our Check Your Health event, which is where all of our lab panels go on sale. You can pre-register for that today also and get a spot to get those, which would give you all of your different nutrient levels checked. So just find somebody with the Reardon Clinic name tag and they can answer questions for you. But thank you all again for coming.
The drawing?
Oh, yes, we need to do the drawing, yes.
Does everybody have their tickets?
Is anybody else not? Yeah, you can have theirs? Okay. Okay, let you draw. You want to draw? Dig deep in there. Linda Pryor. Linda still here?
He's back there.
Okay, thank you.
Thank you very much, everyone.